Welcome back. If you haven't had the flu this season, congratulations. As they say in New England, it has been a wicked flu season. It's been described as the largest outbreak in 12 years. Millions of Americans have been affected on the Suncoast. Late last month, Sarasota Memorial reported over 275 positive flu tests and 90 patients admitted to the hospital. Doctors Hospital reported 3 times as many reported flu cases than a year ago. And joining us for more are Dr. Virginia Good of Good Pediatrics and Michael Drennan, an epidemiologist at the Sarasota Department of Health. And let me start with you and ask you, are we still seeing an incredible numbers of positive flu cases here in the Sarasota area?
Yes, sir. And we use multiple tools to evaluate and to monitor the number of cases we see. We look at emergency department visits. We look at school health room visits. We look at lab reports. And we are seeing right now numbers higher than what we've seen in the past several years. And those numbers are still staying high to right now.
Doctor, what about at your practice?
We are definitely seeing an increased rate of the flu. Influenza A, 2.5 weeks ago, we were having about 4 to 5 patients a day testing positive for influenza A.
And do children basically suffer through the flu more severely or worse than adults?
Usually they suffer through about the same, although we have had 63 pediatric deaths in the United States so far this year.
But it is safe to say that no one on the Suncoast has passed away from the flu at this point that we know about?
That is correct. And to just build on what Dr. Gill was saying, the cases that we are seeing, usually it's in people that have some type of compromised immune system, or an immune system that's not quite as strong as those we'd see like in young adults. So it's usually children less than 5, adults over the age of 65, and people with some type of underlying chronic condition that have the most severe form of the illness.
And I would imagine that would put a lot of people who live in assisted living or nursing homes at risk. Or are you seeing the numbers higher there?
Yes, sir. And traditionally, those are the places where we'd see outbreaks or clusters of the disease. Those people are at greater risk. They're also closer to each other and spend more time in a congregate facility, and so making it easier for the disease to spread.
And doctor, of the children that you're seeing at your practice, how many of them have gotten the flu shot?
Probably about 30% of them.
Why do you think that is?
I feel like fewer parents were electing to have their children vaccinated for the flu this year, because what I heard a lot from the parents was, well, we got the flu shot last year, the child was traumatized by getting a shot, and then the flu vaccine didn't work. Well, this year it is working in many cases, not all cases. So now, with all the media attention with the flu, what I've seen is the parents are coming back in just for a flu shot.
Is it too late, or is it never too late?
No, it's not too late. I believe, and Mr. Drennan can correct me on this if I'm wrong, that a flu season can last between 11 and 20 weeks. And at this point, we are at week 11 in this flu season.
You know, there was a lot of discussion nationwide in terms of the flu epidemic, in that whether or not the flu vaccine that came out this year was addressing the flu that's actually circulating. What can you tell us about that?
So it usually takes a while to collect that number and do the analysis. To the best of our knowledge right now, the flu vaccine is about 30% effective. It usually covers 3 to 4 different strains of flu. Unfortunately, the one that's most commonly circulating right now, this H3N2, is just a little bit more virulent and a little bit more sturdy, and causes people to become more ill. So that's not to say that the vaccine's not effective or not good. It's just maybe not as effective as some people would like it to be. The other thing, the vaccine doesn't just prevent us from getting sick. It can also, if you do get sick, make the symptoms much more milder and less severe. So there's twofold reason to get the vaccine.
All right, and actually I want to pick up on that in a moment. We are just getting warmed up, and we'll have much more on the flu outbreak in the moment, right after we check the first alert weather. Stay with us. Welcome back. We are talking about the flu outbreak, and joining us for more are Dr. Virginia Good of Good Pediatrics and Michael Drennan, an epidemiologist at the Sarasota Department of Health. Dr. Michael was saying before the break that the flu shot may not necessarily not prevent you from getting the flu, but it could make the symptoms a little bit less severe. Number one, are you seeing that? And number two, does that make it a little bit more difficult for people in general to figure out whether or not they have the flu?
Well, I definitely agree with him that the children I am seeing who have the flu and have gotten the flu shot are not as sick as the ones who are not vaccinated. Secondly, they seem to, I don't think it confuses the matter whether they have the flu or not, because they come in, they look sick, and we do a test, and we know whether they have the flu or not. So.
But there are a lot of other things that are going around these days.
Yes.
So what, if it's not the flu, what is it likely?
Well, there are enteroviruses out there, adenovirus, they're rhinovirus, there are many, many viruses. But the flu, the hallmark of the flu is high fever. I see them, they come in with 104 fever, 103, 102, and they are shivering. I say they have the positive sweatshirt sign. They're coming in sweatshirts and wrapped in blankets. They look sick.
And what is the primary way you deal with somebody who is in the middle of severe flu?
Well, lots of fluids. We give them Tamiflu, which is an antiviral, and that usually can at least shorten the flu duration and make it a little bit less.
Let me ask you this question, and I don't want to generalize, but I saw something absolutely tragic in the newspaper the other day about a teacher who developed flu and was prescribed Tamiflu, but the copay was so outrageous, I think it was over $100, that she felt that she couldn't afford it, and she was dead within days. Are you coming across families that you prescribe Tamiflu, but the cost involved is so incredible that they don't know what to do?
Actually, I have that with other medications, but I have not run into that with Tamiflu yet, or I haven't had any complaints.
County-wide, what are we seeing in terms of reaction to the flu outbreak, in terms of the availability of Tamiflu, and is everybody getting it who needs it?
To the best of my knowledge, it is available. There is a higher demand, so that may increase like a wait time. There's more people that want it. But to the best of my knowledge, there is no shortage or inability for people to acquire the medication if they need it.
Right, and when we're talking about vaccinations about the flu, traditionally it is an injection, but there's also the mist. And I know that there's been different kinds of thinking about the mist in terms of how effective it is. Is it currently being used in Sarasota County, and is it working?
It's not. About 2 or 3 years ago, the CDC did some analysis on that. They found that the flu mist vaccine was not effective. And at this time, the manufacturers of those, it's not licensed for use in the United States right now. So no one's using a flu mist vaccine in the United States. They may be using it in other countries, but not here. So right now, all vaccines are injectable. There's a trivalent dose that covers 3 different strains, a quadrivalent that covers 4, 2 A's and 2 B's, and then there's a high dose that's typically going to be for individuals over the age of 65.
Is it possible to say where is it hitting the hardest in Sarasota County? Or are we talking about the school-age population? Are we talking about the, we've had people here at ABC7 who have been out for a week, or is it worse in the senior citizens, assisted living and nursing homes?
So unfortunately, it's not a reportable disease. So there are about 100 diseases in the state that are required by law to report to the health department. This isn't one of them. But we collect anecdotal information that helps give us a good idea. As I was saying earlier, the hardest hit population is usually those less than 5, those over 65, and that's kind of evident in what we see in emergency department visits and what we hear from doctors who do call us just to give us an idea of what's going on.
Are the hospitals and the ERs being overwhelmed by what they're seeing?
I wouldn't want to answer. I don't believe so. I know there's higher demand and more visits, so there may be longer wait time in the emergency room, but I wouldn't want to say that they were overwhelmed.
Doctor, you said that because of what happened last year, it had an impact in terms of fewer families bringing their kids in for vaccinations. Is it the confusion about whether or not of not knowing what to expect, whether the immunization works or not work, really having an effect on kids getting sick, and are you concerned about what's going to happen next season?
I believe next season people are going to be much more likely to vaccinate early on. But I can even see it from a parent standpoint. Giving a 5-year-old a shot is not a pleasant thing, and since the flu vaccine didn't work last year, basically they don't want to give it. Are
you seeing cases where it's not only the child that's getting sick, but a whole the entire family.
Absolutely.
I mean, how are families making it through?
Luckily, one parent is usually spared. So either the mother's not sick or the father's not sick, or they get sick at different times. But I've had several families where they have 3 children with the flu and father with the flu or mom with the flu.
Right.
So
what is the Sarasota Department of Health doing right now, not only to monitor what's going on in Sarasota, but to basically do whatever it can to make sure that, you know, residents here are least affected as possible?
So we've done a couple different things. One, we partnered with the school board in Sarasota, and on Monday and Tuesday of this week, we offered vaccines for free at 3 different sites, 3 on Monday and 3 on Tuesday. We were able to provide approximately 300 to 350 vaccines, and then today a media release is going to go out announcing that we're going to offer free flu vaccines to anybody that wants to come to the health department and get it. In addition to that, we work with those facilities, whether it's a school, long-term care facility, can happen in jails, to help them, if they have an outbreak or clustering of disease, help them with testing and implementing control strategies so they can reduce the effect and duration of the outbreak in their facility.
What do you, let's take it one at a time, in terms of assisted living facilities, are most of them on top of this in terms of getting their residents immunized?
Most of them do the best job they can, and they have higher vaccination rates than the general population. If you look in the general population, it's usually somewhere between 40 and 50% of the people get immunized. Long-term care facilities, nursing homes, usually closer to that 80% of their residents. We usually look for higher numbers in their staff too. That's not always the case. So that does help prevent the spread.
Right, and what about the public schools?
The public schools that's going to kind of be similar to what we see in the general population. It's going to be somewhere between 30 and 50%.
Right, and what are families telling you about how long their children have to stay home and are missing school? I would imagine that it could wreak a lot of havoc on the family life.
Mm-hmm. I would say on average they're missing about 5 days of school.
Wow.
Yeah.
And how long is the fever lasting, and you get onto the road to recovery?
With my population, maybe 4 days, 3 to 4 days. Maybe 5 days.
So, doctor, if there is one piece of advice you could give every mom and dad right now, what would that be?
To have your child vaccinated. If they're 6-month-old or older, get the flu vaccine.
And Michael, what is the one piece of advice you would give?
I would have to echo that. The 2 other things I'd really like to point out, I mean, I know you asked for one, is hand hygiene, washing your hands. That's really going to help you prevent you from accidentally infecting yourself. The other is keep your children home and from school if they're sick, and stay home yourself if you're sick. That's going to really break that chain of transmission. I know it's difficult in both situations, or can be, but that's really going to help prevent the spread of the disease.
All right, why don't we take a quick break, and we'll be back for final thoughts when we return. And our guests join us right now for final thoughts. So, Michael, what would you tell people as we work our way through this outbreak here? And here's another question. What would you tell employers who have employees who are dropping like flies in some cases?
First, I'd like to address the employer question. I think be patient with your employees. Understand that they most likely want to come to work. They're not faking this. Flu is a serious illness, and it makes people really sick. And keep letting them stay home is going to prevent the spread to your other employees or to the patrons of your business. And that's not something that you want to have. Employee missing a couple days is not going to be that big of a deal in the long run. Final thoughts or things I'd like to hit on. One, like I said, we're going to have free flu vaccine for anyone that wants to come to the health department and get that. It's not too late to get the flu vaccine. We usually see a season somewhere between October and the end of March, but it's not uncommon for us to see cases in the summer too. So getting it now, it lasts for a year. Hand hygiene, make sure you're washing your hands. You know, we tell people to cough in their elbow. That helps prevent the spread.
Right, just like our parents taught us.
Just like our parents taught us.
All right. Doctor, I would imagine that for parents, you have 2 problems. You care about your child, you want them to be safe, but I would imagine in our busy family life that it's got to be in the back of a lot of people's minds that if their kids are staying home from school, they're not able to go to work.
Exactly. Exactly. So I have seen cases where they're sending they're giving them Motrin or Tylenol and sending them to school so they can go to work, because employers are not happy with their staff being gone, especially when their staff is not sick, their child is sick. So I reiterate what you said, that employers need to be understanding, and I think also the teachers need to be understanding and not expect the children to do homework while they're home sick with the flu.
Absolutely. Thank you both for joining us today.
Thank you so much. Happy Valentine's Day.
Thank you very much. Before we go, we want to share with you what some of you had to say about last night's show on the House District 72 special election. It looked like a tight race going in between Republican James Buchanan and Democrat Margaret Good. But Good pulled ahead early and did not look back. Good earns 52% of the vote, while Buchanan got 44% of the vote, and Libertarian Allison Foxall received the remaining 3%. We went to Facebook to hear what you had to say, and Kelly says, thank God Republicans have twice as many seats in the Florida House than Democrats, to which Carol responds, not for long. Joseph says, the entitled left, aka community organizers, do a much better job getting the word out. People on the right are too busy working. Really, Joseph? Voter turnout was 36.4%, which may have been a record for a special election around here. And in case you were unaware, Republicans traditionally have done a better job getting the vote out in these parts. And as for people on the right are too busy working, really? Democrats, Libertarians, non-affiliated voters don't work? Think about that. If you'd like to join the conversation just on tonight's topic, just visit our Facebook page at facebook.com/mysuncoast.com. ABC7, and FYI, you can watch past discussions on demand. They're available on Apple TV, Amazon Fire, and Roku. And for the latest on local breaking news, don't forget to download the updated version of our app. If your current app doesn't work, it's expired, just go to the App Store and re-download it by searching for WWSB or My Suncoast. We want to thank both our guests for being here today, Dr. Virginia Good of Good Pediatrics and Michael Drennan, an epidemiologist at the Sarasota Department of Health.